everyone, and welcome back to my YouTube channel. If you're here for the first time, hi, my name is Busari Muliayo. I am a Nigerian. I'm a Nigerian registered nurse and midwife. I'm also a United Kingdom registered nurse, and on this channel I talk about nursing, healthcare, and my lifestyle generally as a nurse. In today's video, I am going to be giving you guys another update about how my career is going since I moved to United Kingdom. I've made a lot of videos from the points of living up till now. So if you want to see all those videos, I'll link the playlist here and also down in the description box below so you can check them maybe after you're done or even before you start watching this one, whatever suits you. But if you're also interested in content related to nursing, healthcare, do stick around by clicking on the subscribe button to join the YouTube family and also the bell icon to get notified anytime I drop another video. Sorry, I stuttered there a little bit. Sorry. So yeah, let's get into today's topic. Just like you would expect when you move from one place to another, there are a lot of differences regarding how nursing practice is done here in the UK compared to what I was used to in Nigeria. And I must confess, for the first few weeks, or should I say the first 1 month, I did struggle a bit. Not because I did not have supportive colleagues, not because the environment was not friendly, but I just had to start unlearning and learning things that I knew before from Nigeria and learning new things that I was not used to before in terms of technology, scope of practice, nursing practice, patient care, and so many other things, which is why I am making this video, because I think I posted it on my WhatsApp TV and I promised to make this video. So first, let's talk about the similarities. I actually have those things listed here, so I'm going to be looking down at my phone from time to time in this video. So the first similarity is that infection control is the same thing. Okay, so don't fall into that trap or that euphoria of thinking, oh, when I get to UK like this, I'll be able to wear long earrings to work, I'll be able to put on full face makeup to the ward, I'll be able to do colored hair or anything like that to the ward. There are limitations to these things. Now let's talk about hair color, for example. Now in Nigeria, the regular hair color that you would see, or the popular hair color, is black fussy hair. That's normal African hair. So any hairstyle that is, bogus, different, or that has a different type of color from this fussy black hair is going to be termed unprofessional based on cultural values. That's just how I'm going to put it. But here in the UK is a bit different, and this is because there are a lot of nationalities or a lot of people living here. So you may find people who are naturally blonde, you have people who are red hair like normally, then you have people who have black hair, black fussy hair, and so many other types, so many hair types. That is why sometimes you may change your hair color and nothing is going to be done as long as it is still a natural hair color. But that does not mean that you can do like multicolored hair and some very should I say alarming types of hairstyles, and people will still not frown at you because you're a nurse and you're expected to look professional. Now down to jewelries. Back in Nigeria, we were not allowed to wear certain types of earrings, accessories to work. It is still the same here, although I was a bit surprised because I used to watch a lot of TikTok and Instagram and see some nurses from other countries before I left Nigeria, and I used to see them wearing full face makeup, lashes done, nails done, full accessories and all to work. So when I got to the hospital and I was told that there are certain accessories or jewelries that I would not even be wearing. In fact, when I go to work, I don't even wear jewelries at all, the same way I was doing in Nigeria. Because of infection control protocols, I engaged one of my colleagues at work and politely asked that, who are the nurses that we're seeing on TikTok, on Instagram, that are always dressed up like this? And, they go to work like that. And all of us expected that once you move out of Nigeria, or once you move out of Africa, all this whole don't wear accessories to work is going to stop. Then I realized that it is a different country entirely. So infection control protocols is the same. So now I understand why you see a lot of nurses online who wear their eye watches on their upper arm instead of their wrist, because I used to wonder, why are you putting your iWatch here? It's not supposed to be on your wrist. And I realized that it's just because of infection control procedures or protocols, sorry. So all those infection control, you're not going to escape it. It's the same here. Another similarity is patient care, the foundation of nursing, your vital signs, bed bath, all that regular procedures that you do as a bedside nurse, you're still doing them here. It's just that most of the time now you would have like other um, professionals like the carers or the healthcare assistants assisting this procedure, but that doesn't mean as a nurse you would not touch your patient at all. You will not do any personal care for your patient at all. No, the personal care you're doing in Nigeria is still coming back to do it here. So those are some of the similarities. Now that I've gotten the similarities out of the way, let's talk about the differences that I have noticed. Please understand that this is not an exhaustive list of differences or similarities between practicing nursing in Nigeria and practicing here in Scotland, United Kingdom. This is just based off my personal experience, okay? Now, first thing is the uniforms. The uniforms are very different. So in the sense that the entire country has a uniform, like they have a, how do I put it? It's like there is a particular company that makes the uniform of nurses or make the uniforms of healthcare workers in Scotland or in UK. So if you see a nurse wearing a uniform, you can easily tell that this person works with either NHS England or this person works with NHS Scotland. Like you can easily tell that this is the country that this person is working. So if you go to a hospital in, let's say, Glasgow, which is like a city, or go to another hospital in Edinburgh, or come to another hospital in somewhere like Iskilbride, or you come to a hospital in somewhere like Aberdeen, you will realize that a band 5 nurse in all of those places, they are wearing the same uniform. Like the same uniform. Or like in Nigeria, where the uniform of one ward is different from the uniform of another ward. Some wards will choose to wear scrubs, some will choose to wear their white uniforms and their white caps. Then I also asked if they wore gowns. Then I realized that nurses in England, they do wear gowns, but nurses in Scotland, they don't wear gowns, which obviously the weather, although they said in the past they used to wear it, but I don't know. But trousers are actually like trousers and fleece are like the the general uniforms here. So the uniforms are different, and also the way their hierarchical structure is set up is very different. In Nigeria, you have things like NO2, NO1, SNO, CNO, PNO, ADNS, HNS, whatever, which is based off years of experience, and you get promoted like maybe every 2 years or every three years if the government does a promotion. But here it is quite different. You can be on a particular cadre throughout your nursing career if you don't want to move up, if that is what you want, and you can move up very fast if that is what you want, as long as you have the experience and qualifications that are needed. So there is no specified you must spend 5 years in band 5 before becoming a band 6, or you must spend 10 years in band 6 before becoming a band 7. No, if there's an opening for that band and you already have whatever requirements for going to that band, you can apply. Even if you have only spent like 2 or 3 years in your current role, you can move to the next role. So you can have a band, so on a ward now you can have a band 5 that has been a band 5 for 10 years and have a band 6 that has only been in nursing for 6 years. So it's just based off your personal experience. You don't understand, like you've been in the nursing system or nursing career for 10 years, and there's another person who has been for 6 years that is already your senior. So there's nothing like you have to go from so the hierarchical structure is very different from what I am used to. So it is based off qualification. So if you, and there are some roles that you cannot get if you don't have a particular qualification or what they need for you to be in that role, and their specialization is actually also different. Like you always have to go to a post basic school, you have to go back to school, like go back 18 months and so many months like to study to get maybe a role in a particular part of the hospital. But here it's not really like that. It is more, I'll just say that it is more flexible. That's just what I would say. Another thing I want to talk about is the scope of practice. The scope of practice is, should I say, very diffused. Is diffused the right word? Or they break it into small bits. So the fact that you are a nurse does not mean that you are able to do certain procedures if you have not been trained for their procedures and for those procedures. And the fact that you are not a nurse does not mean you cannot do something as long as you've been trained for it. So if I have not been trained to cannulate patients, and there's a clinical support worker that has been trained to cannulate patients, that person is going to be the one to do the cannulation, not me, even though I am the registered nurse on duty. That is where I first heard about mean CSWs, and I was so amazed, like having people who are not nurses who are trained specifically to cannulate patients. So the scope of practice is actually very different. There is no rigid if you're a nurse you must do everything. No, you can always delegate, and they more or less share their tasks, and I really love that. Oh god, I'm talking too much, sorry. So the next thing I'm going to talk about is technological advancement. Of course, it is not unexpected that moving from a country like Nigeria and coming here to UK, I would not have issues adjusting to technology. I did, because a lot of the things that I was used to doing manually back home, I now had to start using machines and a lot of new devices to do them. So that's why I said I had to do a lot of learning and learning new things. And if you don't put your mind to those things, you're not going to get it very fast. But I think because of the type of rigid training I had as a Nigerian nurse, let's not joke here. Nursing training in Nigeria is very rigid. It is not, it is tough. So because I was used to like learning under very tough and pressurizing situations, it was easy for me to just switch and just bring that pressure of being a nursing student back. So I had to like more or less regress back into that mood or that mode of being a nursing student, always asking for directions, writing things down, going to the ward with a notebook, writing, making research, coming back home, read, as if every day on the ward was like every day of me going to class. So within 2 to 3 months, I was able to balance fast. I'm not going to say that I am an expert and I know everything now, but it is a lot better than when I first came and I had to start learning so many new things, including terminologies. So in fact, I had to learn so many new things. Even the way they document is different. Most of things are done online, and not that we didn't do a lot of online things in Nigeria, but it's not as much as it is done here. Even all your vital signs charts and everything is done online. You have to use so many softwares. Like I have so many passwords I have to like cram and memorize. I have a password for giving medications, I have a password for doing vitals, I have a password for admitting, I have a password for printing labels, I have passwords for almost everything. Even though you still do like paper-based documentation, you do a lot of um online documentation. So technology is another thing. Now let's talk about money. The payment structure. Now, I don't want to be biased, because when I was in Nigeria, I would say that I was lucky. I'm not even going to lie, it doesn't work that way for everybody, but at least I got a job that paid me like fairly well. When I compared the cost of living of where I lived to what I was earning, it wasn't that bad, and it was a lot better than people that were working in other professions aside me. But the payment structure here, I kind of like how it is structured, because if in Nigeria there's like a cap. Did I say cap? I don't know the right words to use, but I think cap is appropriate right now. There's a cap on your money. In other words, it doesn't matter if you're working night shifts or you're working day shifts. It doesn't matter if you're working in the clinic or you're working on the ward. It doesn't matter if you're working afternoon shifts or something, or you're coming overtime, your salary is your salary. If your salary is 120,000 every month, it's that 120,000 that you keep getting every month. Even if you do night shifts from the beginning of that month to the end of that month, it's still that 120k that you get at the end of the month. Except you work in certain should I say specialties, maybe like the theater, where you get paid like maybe call allowances. And even at that, if your call allowance is 20,000, it's that 20,000. Even if you do call from beginning to the end, it's still that 20,000 that you get call allowance extra that you get on top of your 120k. So there is like a limit and a cap. And another thing is, if you work with the federal government, you know that okay, my salary is going to be higher. Then if I work state government, my salary is not going to be as high as somebody that is working in the federal government. And if you work in local government, your salary is probably going to be lower. And if you work in the private sector, it depends on whatever your employer says. There is little to no standard. So you can have a nurse that has 1 year experience that is earning good, and a nurse that has been working for years in the private sector that is earning very bad. There is no regulation, yeah, to private healthcare facilities as to how much they pay their nurses, but here it is quite different. The more you work, the more you get paid. And if I work more than you, even if we're both band 5 nurses, I am going to earn more than you. Take, for example, situations. For example, I work on the ward. So it means that I do night shifts. Sometimes I come to work weekends, and sometimes I come to work during public holidays. Now, somebody that works in the clinic who doesn't come to work maybe during weekends, who doesn't work night shifts and doesn't work on public holidays, is not going to get as much pay as I am. So let's say, okay, let me just make a very, I'm trying my best to like make a very good example. So for every night shift you do, there is like an extra allowance that comes. If you work on the weekend, there's extra allowance for the weekend. And if you work on a public holiday, there's an extra allowance. Then if you work overtime, that means probably you have done your 37 hours for that week. You now come to work one extra day outside those 37 hours. You are going to get paid for that day extra. So, no, if you are coming to work on the day you're not supposed to come to work, you're not doing anybody a favor. You are coming to work, they will thank you for the favor, but they will still pay you. So it's not free work or like slavery or anything. Nobody can just call you and nobody can force you to work overtime. You can decide that, okay, I want to come to work. If they tell you that, okay, there is a shift available and we need somebody to cover this shift, you can come in and work overtime on that day and get paid. And if it's a night shift and you work overtime, you still get your extra pay for being a night shift. If it's a public holiday, you get extra pay. So people tend to come to work extra for night shifts, for public holidays, and for weekend shifts to increase their income. So the more you work, you get paid for everything you do. So it is, I think I like it. And they have like a measure to guide against short staffing. That is your agency staffing and your bank staffing. So you can also register with an agency and bank. But I can't really say much about these two because I am not really putting into any of those yet. So, but for the overtime, I think I have a very good idea of how overtime works, how night shift works, and how weekend shifts work, and how public holiday shifts work. So, yeah, that pay structure makes me very, very happy. And at every year, like you get like a raise every year until you get to like the top of your band. That means that if you're a band 5, there is a limit how much you can earn except you move up to the next band. So that is a very, very huge difference. The payment structure here and the payment structure back home is like very, very, very different. Any other thing I want to talk about? I think, yeah, as specialization and career development here is also different. You can decide to move into a different career path as long as, I think I mentioned something similar to that. You can decide to move out of bedside and non-bedside nursing roles. Yes, non-bedside nursing roles are very, very popular here. There are a lot of non-bedside nursing roles, and how to get into those roles, the information is out there in the open for people, which is quite different from what we have back home in Nigeria. That information is like people get to keep information a lot. You know, people, you ask somebody, how do I become an occupational health nurse, and they don't want to tell you, or you ask someone, oh, how can I get into renal nursing, and they're just saying go to post basic or go to post, like the information is not just like out there. You have to go and meet people, go and meet people, go and meet people. And even when you get those qualifications to get a job, you have to hustle, 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 hustle. It's a lot, but these are some of the similarities and differences that I've noticed. If you want to see more of my videos, click on this playlist. Don't forget to subscribe, and I'll see you in the next video. Bye.